But first, a brilliant young academic has just come up with an idea to fight this coronavirus. An idea so simple, so obvious that I think it could be a game changer, provided our politicians start thinking creatively, and they should. Because you just look today. Look at the damage being done by the way that we're fighting this virus now. The shutdowns. Melbourne shut down again today, by the way, another 403 cases in Victoria and 5 deaths. But the damage. Treasurer Josh Frydenberg today gave us the financial bill of the shutdown so far, and I stress, so far.
These harsh numbers reflect the harsh reality we face. The economic outlook remains very uncertain.
Now, I'll go through some figures in a minute with Andrew Clennell, but here is the bottom line. 1 in every 11 workers will soon be out of a job and will be getting a lot poorer in the year ahead as well. Growth figures, well, they're just going backwards, 2.5% next financial year, or this financial year. And this just shows that if we keep shutting down parts of the economy, every time there's an outbreak, like in Victoria, we will break this country. We will break a lot of people. So, to this brilliant new insight. Now, one of the big reasons that Victoria is struggling to keep this second wave under control is not just because it's failed so horribly in keeping this virus out of nursing homes, with 3 of the 5 people today dying in those homes. In fact, 1/3 of Australia's dead have died in aged care. Now, I think that's a scandal that we haven't protected them better. But there is, in fact, another factor that I don't think anyone's been talking about. And it involves the testing, the delays. Now, right now, here's how it works, but all states is basically the same. Now, apologies if I'm going to get a bit too scientific, but this is really important. This could save your life, could save your job, could save our economy. Now, right now, people generally get themselves tested only when they feel they might be sick, sore throat, whatever. They might wait a day or two to make sure there's the cough going away, then eventually drive to a testing station, have a swab stuck up their nose, which is not nice. One reason that some people refuse to get tested, although there is also a spit test now in Victoria. But either way, either test, you've got to then wait, says Victoria's Health Department, for 1 to 3 more days for your results to come back, maybe even longer, it says. Now, in that time, you're supposed to stay at home, although more than half of us don't, as Victoria's Premier said today.
The vast majority of people who are getting tested have symptoms, and 53% of them are not isolating between when they have the test and when they get the test result.
Okay, you're starting to see the problem here. It can take 3-4 days, maybe more, between the time people wake up thinking, oh, am I sick, to when they're told officially they are. And in those days, more than half don't even stay at home. Right? Walk down the street, maybe infecting who knows what. The thing is, there's a study in the New England Journal of Medicine confirms, it's actually in those first 3 days of feeling sick, when they might be waiting for the test results, that the viral loads in patients is really off the scale. It's that big line at the top. That's when you're at your most infectious. That's before many people get tested and then get their results. Until then, many are wandering around. So clearly, we need a test that's almost instant, that you could do at home. You wake up, oh, my throat, test yourself, instant. Positive, stay home. And the good news is that there actually is such a test, a paper strip test. You put spit on it, you wait maybe 10 minutes, that's all, 20 minutes maybe, and then if the second bar on that paper, and that's the ones on the right, that second bar, you get that result, says you're sick. And you'll stay at home, hopefully, if you're at all responsible. And even better, there's no pain involved. Nothing up your nose, and it costs just $1.50 to $3 a go. Here is the man pushing this test, Assistant Professor Michael Minner at the Harvard School of Public Health.
Everyone tomorrow could wake up, test themselves. You'd immediately filter out tens of thousands of people potentially who have the virus in them that day. And the other consequence is you don't have to worry about contact tracing because everyone would be doing their own test every day. It just, it can be done.
There's another very big benefit. Many people who get this virus either feel no symptoms at all or symptoms so slight that they ignore them and carry on, still infecting people. In fact, an astonishing figure. The New South Wales Chief Health Officer guesses from pathology tests and tests on pregnant women, blood tests, that 500,000 Australians may already have got the virus. 500,000. But note, tests have only picked up 13,000 of them. So, a painless test like this, cheap, do it at home, out of curiosity even, could pick up thousands and thousands of infected people who'd otherwise never have got tested.
9 out of 10 people go undiagnosed with this virus today in the US. I would say that of those 1 out of 10 that do get diagnosed, almost all of them are getting diagnosed through surveillance after they've been infectious. Because their CT values, we've seen the average CT value kind of creep up to 35 or so. So that means they're almost all at the tail end.
Now you'll think, if this is so brilliant, picking up people straight away, instant result at the moment they're at their most infectious. If this is so brilliant, why aren't we already doing it? Well, first off, of course, it's new. Second, governments, they want to control the process. They want to know who tested positive so they can chase them up and whatever, And a test yourself kit takes away their control. Although, really, if you think creatively, there are ways around it. For instance, you could make a rule that people can't come into this or that office or public transport unless they show today's test results. Something like that, whatever. But the big objection is this. The studies have shown that these results are nowhere near as accurate as the swab up your nose, the test that takes days. Then you might think, well, that clinches it. If they're not very accurate, we can't use them, can we? But the reason they're not that accurate is these paper tests don't actually pick up low viral loads, either the very first hours of infections or after the worst has passed. You're lying there recuperating. But that's also when people are not that infectious, if at all. And Dr. Minner says, no problem. Because this test is so cheap, so easy, you just test yourself every single day and you'll soon know, and you'll know when it counts.
It doesn't need to be perfect. You have one kid who tests negative and, they actually go to school. Well, that kid, otherwise that kid's not going to get tested at all, so they'll find themselves positive the next day and they'll infect overall fewer people, and anyone that they infect will on average find that they have been infected and they'll stay home. So it very quickly compounds into a massive reduction of virus in the population very quickly.
Now, again, I hope this hasn't been too scientific and too involved in all that. But the point is, politicians have got to know about this because lives could hang on this. Our economic future as well.